Varieties. Acute urethritis. Urethritis is considered the most frequent form of gonorrheal infection of the female genitalia. This is probably due to the fact that in the beginning of the sexual act, the labia majora are pushed apart by the glans penis, and the urethral orifice in this way is put on the stretch. The ducts of Skene's glands lying inside of the urethral orifice are then brought in direct contact with the infecting discharge from the male urethra, as is the lining epithelium of the female urethra. And as this epithelium is columnar, the infection readily takes place. Symptoms. The patient usually complains of an intense burning discharge at the urethra and a sense of burning or, quote, sticking pain on micturition. Sometimes there is a marked tenesmus or even retention if the patient is nervous. She may note that she passes a few drops of blood at the end of urination. Examination generally shows an intensely reddened urethral opening, oftentimes with the swollen mucosa bulging out of the orifice, giving the appearance of a prolapse. Pus is seen oozing down over the mucosa. The orifices of Skene's glands may be conspicuous, or they may not be demarcated from the rest of the violently congested mucosa. Palpation of the urethra per vaginum, care being taken to carry none of the pus up with the examining finger, gives acute tenderness. Oftentimes, the urethra feels like a cord under the finger. Diagnosis. Diagnosis is not difficult if a careful history has been elicited. A smear taken of the discharge should show gonococci. Urethritis following infection by catheterization can usually be excluded by the history and the absence of gonococci in the smear. Urethritis caused by the irritation of concentrated urine, chemical irritants, traumatism, or the exanthematous diseases can usually readily be excluded by the history. Treatment. Rest in bed and absolute cleanliness are essential in treating acute urethritis. The attendant should be warned of the infectiousness of the discharge and all soiled dressings destroyed. 3 or 4 times a day, the urethral orifice and vulva should be gently flushed off with copious hot irrigations of boracic acid solution or bichloride of mercury 1 to 6,000 or Lysol 1/2 to 1%. These irrigations can be given by means of a fountain syringe with the patient in the dorsal position on a douche pan. After the irrigation, the vulva should be covered with an absorbent pad. The diet at first should be mainly liquids, milk, broths, and non-irritating foods. Condiments and alcohol in any form should be absolutely forbidden. The patient should be encouraged to drink large quantities of water. If the irritability and tenesmus is marked, a urinary sedative should be administered, page 220. As the most acute symptoms subside, local applications should be made to the urethral opening after the irrigation has been used. 2 to 4% Proterol freely applied by means of a swab around the urethral mouth and openings of Skene's glands may be very helpful. Argyrol, 10 to 25%, can also be used. These applications can be made once or twice a day. A certain number of these cases respond promptly to treatment and make an excellent recovery, but unfortunately, many pass into the subacute or chronic state. As many cases of acute urethritis are combined with cystitis, it is often necessary at the outset to start bladder irrigations. See acute cystitis.